one's way.
One of the differences I noticed comparing Iranian and Canadian nursing practice is needle safety regulation. Safety engineered needles like these two are hardly available and barely used in Iranian nursing practice, and we used to use these kind of needles. In Ontario, needle safety regulation made under Occupational Health and Safety Acts mandate availability of safety engineered needles for all healthcare workers and through all healthcare settings. According to National Survey of Work and Health of Nurses, 48.4% of nurses have experienced needle stick at some point in their career, and these contribute to bloodborne disease like hepatitis B, hepatitis C, and HIV. Based on CDC Center for Disease Control and Prevention, nearly 80% of all percutaneous sharp injuries are caused by needle stick, and 56% attribute to hollow bore needles like this one. As stated by Gail Beatty, RNA or nursing policy analyst, the utilization of safety engineered devices like these two contribute to decrease the needle stick injuries by 62 to 88%, so they are safer to be used. On the other hand, one of the similarities that I noticed comparing Iranian and Canadian nursing practice is valuing the patient's autonomy and patient's choice by reinforcing consent. In both jurisdictions, nurses are responsible for individualizing the care plan for patients and obtaining consent to fulfill the patient's autonomy. According to College of Nurses of Ontario, nurses are accountable for obtaining consent, whether the intervention or services related to treatment, to admission to the facility, and to provision of the personal assistant services. And the consent should be based on the treatment proposed, should be informed, should be voluntary, and should not be obtained through misrepresentation or fraud. And healthcare practitioners who propose the treatment are responsible to receive the to obtain the consent. And nurses who obtain consent are accountable to satisfy that the patients have understood the treatment and the consent is in place before any treatment have been received by the patient.
My name is Hello, my name is Ryan Ramones, and I'm going to compare Philippine and Canadian nursing practice. One of the major differences between the two countries is their bed occupancy. In Canada, patients have their own beds and curtains for privacy. In the Philippines, private hospitals cost a lot, which is why a majority go to public hospitals. Because of the high number of patients, public hospitals are forced to put 2 to 3 patients in one bed. Philippine nurses have a hard time upholding ethical principles stated in the Philippine Nursing Code of Ethics. One ethical principle states, personal information acquired in the process of giving nursing care shall be held in strict confidence. This addresses privacy and confidentiality, which is difficult if there are several patients in one bed. Another principle states, the preservation of life, respect for human rights, and promotion of healthy environment shall be a commitment of a registered nurse. Crowded beds cause safety and health issues that can be harmful to patients. One strategy that the Philippines can take from Canada is shortening the hospital stay by promoting nursing care at home. A study by Bernard and Foss 2014 indicated a positive effect of programs for patients that continue care in their own homes or communities. There is no single solution in fixing unsafe bed occupancy, but exploring community care as well as strengthening health promotion and prevention can ease the crowded public hospitals. There are also several similarities. One major similarity is giving importance to the interprofessional collaboration as demonstrated during change of accountability when a shift starts. During a shift change, nurses from both countries would inform the incoming nurse with any new developments or things to watch out for in patients, as well as coordinate with the healthcare team for any updates. This fulfills the recently released Canadian Code of Ethics for Registered Nurses 2017, with emphasis the ethical principle of being accountable, and Canada's core competency of professional responsibility and accountability for entry-level registered nurse practice. The Philippines also have similar practices and nursing professionalism. A study by Ketcherside et al. 2017 indicated that interprofessional collaboration amongst the healthcare team helps improve patient care and their outcomes. Both Canadian and Philippine nurses must continue to promote better communication and teamwork through interprofessional education so that they can build more nurse empowerment and improve the quality care provided to patients while maintaining a healthy professional working environment. Thank you.
Hello, my name is Gulara Kazimova. I am an internationally educated nurse from Azerbaijan. I am also currently practicing nursing here in Canada as a registered practical nurse. There are many similarities as well as differences in the nursing practice in Azerbaijan and in Canada. Here I will discuss one different and one similar practice. Perhaps the biggest difference is informed consent. In Canada, nurses, before initiating any contact, care, or treatment, must obtain patients' informed consent. This practice is in accordance to the Canada Healthcare Act, which states that consent to treatments must be informed, voluntary, and related to the treatment being proposed. Also, consent cannot be obtained through any misrepresentation or fraud. In contrary to this, in Azerbaijan, as a nurse, I did not have to obtain patients' informed consent before initiating a treatment. For example, before starting a chemotherapy for a patient with cancer care, I could tell him or her that I'm going to start his antibiotics or IV fluids. That is because in Azerbaijan it is considered unethical and even cruel to tell someone that they have a serious life-threatening disease. If I told my patient the truth about the medication I was about to initiate, my patient, his or her family, and the entire healthcare team would be upset and angry with me. However, in my opinion, misleading patients about their conditions in order to protect them from bad news gives healthcare providers the authority over patients. It does not respect patients' autonomy to make decisions about their health. As an example of a similar practice would be documentation. As in Canada, nurses in Azerbaijan must ensure that patients' records present a timely, accurate, and comprehensive pictures of clients' condition and needs, nurses' interventions, and clients' outcomes. Nursing documentation serves as a communication tool within the healthcare team. It is also necessary to ensure the accountability of healthcare providers. As in Canada, in Azerbaijan, nursing documentation is required by law, and nursing records are legal documents. Nursing documentation is also used in research and quality improvement. I think timely, clear, and comprehensive documentation is crucial to positive client outcomes. I'm glad that in Canada and in Azerbaijan, documentation requirements are the same. Thank you for listening.